Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Chemotherapy side effects. People with cancer are often concerned with what chemotherapy side effects are going to occur during their treatment. They often hear about how terrible chemotherapy side effects are and how sick you can feel. What many people don't realize is that these days, many people do not suffer as many side effects. Medications can prevent some of the more unpleasant complications. /r/n/r/n How your medication affects you depends on many factors, such as how aggressive treatment is, overall general health, and what type of cancer. /r/n/r/n Chemotherapy can produce many side effects, including /r/n/r/n There is a wide range of side effects from chemotherapy. Remember that not everyone will experience side effects. One person may experience many effects, while someone else may only suffer from one or two side effects. /r/n/r/n Chemotherapy works by killing cancerous cells. However, sometimes it is aggressive against healthy cells, too. Since chemotherapy travels everywhere in the body, damage to healthy cells can occur at various places in the body. /r/n/r/n Hair loss is one of the most emotionally devastating side effects of chemotherapy. Chemotherapy can affect the hair on your head, facial hair, pubic hair, and body hair. This includes eyelashes and eyebrows, also. /r/n/r/n Hair loss occurs because chemotherapy can sometimes damage healthy cells. It is so common because hair follicle cells multiply very quickly like cancer cells, and chemotherapy drugs have difficulty in discerning the difference. /r/n/r/n There is no way to tell if someone will lose their hair during chemotherapy. Some people do not lose any at all. Some only suffer from thinning of the hair. However, there are many people who do lose all of their hair. /r/n/r/n Hair loss all depends on the medications you are taking, dosage frequency, and how aggressive your treatment is. /r/n/r/n Unfortunately, there is no guaranteed way to prevent hair loss during chemotherapy treatment. Scalp hypothermia, in which ice packs or cooling caps are placed on the scalp before a chemotherapy treatment, can be effective at preventing hair loss in some people with certain types of cancers. /r/n/r/n Many people try to use over-the-counter hair growth shampoos, like Rogaine. Research has not proven this to be effective at reducing hair loss for chemo patients. /r/n/r/n The National Cancer Institute says that hair usually starts to grow back 2 to 3 months after chemotherapy ends. /r/n/r/n Hair loss can be devastating. Many patients feel like they can't go out in public, or that they will embarrass their family members. It's completely normal to feel this way. But, you can do many things to make your hair loss more acceptable and easier to cope with. /r/n/r/n Hair may be different when it begins to grow back. Some people find their hair a different color or texture. /r/n/r/n Tips for maintaining hair during chemotherapy, whether you have very thin hair, or haven't lost any at all. /r/n/r/n Coping with hair loss can be difficult. We often associate our hair with physical beauty. Without it, it's hard to feel attractive. /r/n/r/n Wigs and hairpieces can make a big difference. Many look so natural, no one will recognize you are wearing a wig. Have fun exploring different looks with wigs. /r/n/r/n Have comfort in knowing that your hair will grow back. Many times, it will grow back in better condition than what it was prior to treatment. Call it Chemotherapy's Compensation Policy. /r/n/r/n Diarrhea is the passage of loose or runny stools. Frequent diarrhea can irritate the skin around the anus, making sitting or lying down very uncomfortable. It can also result in weight loss. /r/n/r/n If diarrhea persists,
Talk to your healthcare provider about using an over-the-counter antidiarrheal medication, like Pepto Bismol, Immodium, or Kaopectate. /r/n/r/n If symptoms persist, your practitioner can prescribe a medication such as Lomotil to combat diarrhea. /r/n/r/n Nausea and vomiting during chemotherapy can cause severe loss of appetite, which in turn causes nutrient deficiencies. /r/n/r/n Odors and certain smells can cause nausea as well. Usually, this is from the smell of food cooking or laundry detergents, and sometimes even shampoos or perfumes. /r/n/r/n Healthcare providers usually prescribe an anti-nausea medication if it is likely you will suffer from nausea or vomiting from the medications. Common medications to fight nausea and vomiting are /r/n/r/n You can still continue to experience nausea and vomiting after taking these medications. There are several medications for your healthcare provider to prescribe. You might need to try a few different ones before you find the right one for you. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.